Could I sort of ask how you feel? It must be a bittersweet welcome back.
Yes, it's a bit, I feel a bit guilty that I can leave when they can't leave. That's the main guilt. But then I'm also quite anxious about the patients that I've left behind. And the malnutrition is the biggest problem at the moment that we have in Gaza, and it's hitting the children more than anyone else. It's specifically targeting the under fives because they're growing at such a rate. And what you notice straight away in the trauma victims is you look at them and you'll think they'll be about 5 or 6 and they turn out to be 11 or 12 because they're just chronically malnutritioned. They are lacking the essential vitamins and nutrients that they need for adequate cell turnover, so they're not healing as quickly as we've seen before. So our mission in August and March, we saw a lot better healing than we did this time. Malnutrition has a really deleterious effect on the immune system, so you can't fight off any infection really, and that was our biggest issue, was that they were susceptible to infections at rates that I've never seen before, and also minor infections would become very out of control very quickly. We lost 2 children while we were there to overwhelming sepsis. And then coupled with that is the fact that because the living conditions are such that everyone has been displaced about 15 times and they're living in tents in the dirt with no sanitation, and the water is contaminated. There's very little fresh water left. You've got these bombs going off that are throwing all of that into the wound. So you've got all of these filthy wounds and then no resources to fight the infection. And then we've got no medical supplies. So we're running out of antibiotics left, right and centre. So at Nasser we basically had 3 antibiotics, a choice of 3. And none of them would be antibiotics that I would use in contaminated open fractures that I was seeing there at all. They would be like 3rd or 4th line.
And in terms of the impact on your colleagues, your Gazan colleagues as health workers?
The first thing that we had hit us this time was the evacuation order. So we were there when the area around Nasser went into evacuation. And on that day we lost 4 people immediately because they had to go and move their families. They send an alert out and they give you 15 minutes to evacuate. They'll give you this warning that you're now in the evacuation zone and you've got to go and move your family and all your belongings. And they used to drop flyers with little maps on showing you where you've got to move to, and this bit of Gaza would go red and there'd be a big yellow arrow saying go to Al Mawasi or go to wherever. Now they send it on phones and they've got a website.
In text messages and WhatsApps.
And they've got a website, idf.il, and if you go on there it picks up your location immediately and it tells you where you are in relation to the red zone and where you should go to. And so constantly the staff have got that on the laptop in theatre, just watching it. And that day, I think it was the Tuesday, the first Tuesday we were there, we had an order and it hit a lot of people. So
there was an order to move by the Israeli Defence Forces.
Yeah, so one of my anaesthetists, I mean, he's got a family of, he's got 5 kids, the youngest was 2. He had to go and get his wife, all his kids, and walk 22 kilometres to the coast to pitch a tent, to put them all in, and then walk back to finish his shift, because he was on a 24-hour shift. So that's one of the ways that it's sort of affecting them. But the other ways, I think they're very tired now. They've been at this for nearly 20 months. They're sick of it. They all tell you that they'd rather die than carry on. I think that good old Palestinian resistance is going. They're really sick of it now. They've all lost significant others as well, which is really hard. When I was there in August, my scrub nurse Fadi lost his 8-year-old son, and that was really hard when he came to work, because we all knew what had happened, and it's just really tough. I don't know how they come in after that sort of thing. So,
a very difficult question, but who do they blame and what do they want to happen?
I think they blame Israel. I think they rest it solely on Israel. They, they just want a ceasefire, but at the same time they don't want to give up their land. That's their home. It's very clear that there is a resistance to what Israel are doing.
Would they want Hamas to do a deal and just release all the remaining Israeli hostages and alive and dead, and just come to some kind of situation whereby the fighting stops?
They don't want to be kicked out of their land. That's their home, and they've seen it get smaller and smaller and smaller. And I think for them to actually be moved out, they'd rather stay and die.
You've said that the impression that President Trump and Prime Minister Netanyahu describe as the situation on the ground in Gaza is not one that you recognise as being there. Do you think you crossed the humanitarian line in saying that?
I didn't intend to cross a humanitarian line. What I intended to get across was this is not a military operation to get rid of a terrorist.
That's what Israel says it's doing.
It's not, because 5-year-old children have not been recruited by Hamas, to my knowledge, and there's an incredible number of them that have been blown up. And the injuries that I see in 5-year-old children are as if the bomb has been directed at them. It's not just bits of shrapnel wounds. This is coming in with your leg blown off or your arm blown off. It's very in their vicinity. There's no way that these wounds were inflicted as the children were innocently bystanding. These are massive, massive wounds.
Is that because, let's be honest, that Hamas, describe them as you want to describe them, but they fight their war against Israel in a way that implants them in civilian buildings. Now I'm going to come on to medical facilities, but are those wounds happening because there are Hamas fighters nearby civilian buildings?
I'm not really au fait with Hamas and their numbers, but if that is the case, everyone in Palestine must be Hamas to justify the sort of bombing and damage that I've seen. I mean, everyone must be Hamas, because there's nothing left of the place. It's everywhere. Everyone is getting hit all the time. So the only way that this could be justified is if every single Palestinian was working for Hamas. I'm in it for the humanitarian side of it, and I'm working with a group of doctors and surgeons who happen to be Palestinian. Are they Hamas? I don't know, but they're working with me, and we've got one objective, and that really is to stop more children dying. And I think England and the United Kingdom could do more to stop more children dying.
Evacuation of children in Gaza with very specific needs medically, that's something you and your colleagues are working on. Tell us about that.
Up until the Rafah border closed in May, about 4,000 children were evacuated, and we were managing to evacuate both trauma and non-trauma. So you have to remember that while this war is going on, we still have children with cancer, with sarcoma, with congenital deformities, cleft lip and palate, things that need surgery in a timely fashion. And it was possible to put them on a list, and the WHO and the UN would coordinate with mainly the other Arab countries to evacuate them. Egypt took them the most, followed by Kuwait, who then got saturated because they're quite a small country. But the Arab Emirates, Turkey have taken a lot, and the EU's taken, I think, almost 130 or something like that. What's happened since the ceasefire is that only 146, I think, have been evacuated.
Is there anything that you feel you want to ask the British government to do, specifically with regard to humanitarian operations?
I think we should take more of the evacuated children, particularly because we are the leaders in Western medicine. I mean, the British medics are so well trained. I notice it when I'm out there, that we are so much better trained than a lot of the other countries that are helping out. We have such specialist skills that we could really make a difference. And we have a whole host of charities, particularly Project Pure Hope, who have the finances so that it wouldn't affect the NHS.
There's only one country that really can and has affected something of any breakthrough, and that's the United States.
I think that's probably fair that the United States have got the biggest say in it, but we aren't an unheard voice. I mean, particularly with Europe, we would be a very strong voice, and with Canada as well. And I think when you look at the way that apartheid stopped, it wasn't overnight and it wasn't one country. It was a very gradual cessation of relationships with South Africa because of what they were doing. And I think that if we started it, it would domino effect the whole of Europe very quickly. In fact, there are countries that are considering it before we are. So I do think that we need to do something, because it's a humanitarian crisis. We're running out of time. We are really running out of time. I don't know.
Running out of time of what?
To help out here, to sort this problem out, before there is, you know, a loss of more lives than I wish to even go into. Nasser is the last standing hospital in the south.
Do you plan to go back?
I don't think they're going to let me back.
But if you could?
If I could, I would, yes. I definitely would go back.